Welcome to Humanitarian Horizons. I am your host, Christina DiArcangelo. I am a patient advocate, mother, and someone who spent years fighting for those who've been overlooked, dismissed, and left behind by systems meant to protect them. In August of 2025, my son, Christian, was abruptly discharged from a national mental health provider. The reason? They claimed he was uninsured, but that wasn't the truth. I had provided them all of the information that they needed for the insurance well in advance to the new policy taking over, and they decided as a collective group that they were going to illegally discharge my son from their care for no reason. They thought he didn't have insurance. He had insurance. They didn't bother to look properly. And so they just kicked the can down the road, in my opinion, and terminated my son. For any parents listening, imagine your child is struggling and you finally find a provider. You pay the copays, you coordinate the appointments, some cases attend those appointments with the adolescent, and then just overnight, you receive an email that your child has been dropped. It took me days of calls, emails, and escalating my complaints to get him reinstated. During that time, his testing that we were going to proceed forward with was not able to be completed, which meant that his testing was delayed and still is delayed. Every missed week, every canceled appointment can get even more confusing, especially with emotional dysregulation, and it causes more pain for our children. Now, let's be honest. This isn't just my story. I have spoken to countless parents across the country who have faced the same nightmare. Providers who cancel appointments with no notice, inconsistent billing and copays, long waits, months even, to see a child psychologist or therapist, and worst of all, lack of accountability when children fall through the cracks. In my case, we had multiple appointments, we had rescheduling, we had provider changes, there were all kinds of things that were going on, all kinds of things, okay? However, there was a pattern, and in my opinion, the pattern is clear. Families are treated like transactions, not patients. Our children, who are part of a protected class, just like the elderly, are not getting the priority or the protection they deserve. Let's talk about when this happens, what it does to a child. Imagine being a child wherein you already feel that you're battling mood instability, anxiety, trauma, grief, and each time you think you're going to get help, it gets pulled away. One day your therapist cancels, the next day your evaluation gets changed or rescheduled. Meanwhile, your child is just sitting there waiting for support. These disruptions don't just frustrate families, they worsen symptoms, break trust, and teach our kids that help isn't reliable. And for parents like me, advocates, caregivers, professionals, it's just heartbreaking. You try to do everything right. You get insurance, you pay, you document, you communicate, you're transparent, but the system fails. It fails you, and your child pays the price. The truth is, pediatric mental health in America is in a crisis. There are not enough providers. Those that exist are overburdened, undersupported, often run by corporate systems that are more focused on profit than patients and the outcomes for those patients. Whatever happened to the days when it was patients over profits? I have no idea what's happened to that. And is it because of the world we live in today? Is it because of the country that we sit in? Is it because, people just think they can get away with these things because there isn't any accountability? Because these people oftentimes get away with it until patients come to us through the nonprofit and we handle the case, or when it happens to me and it's my son. It's very sad. A lot of times appointments are booked months out. Follow-ups are inconsistent. Parents are blamed. Insurance coverage is mishandled. But at the core of this crisis is something even deeper. It's a lack of humanity. Mental health is not a luxury. For children, it's a lifeline. It shapes their development, their self-worth, their ability to function in school and have healthy relationships. And yet, we treat their care as optional, as something that can be delayed, canceled, or mishandled without consequence. That is not healthcare. That is called neglect. So what can we do? First, we need transparency and oversight in the pediatric mental health organizations, especially large multi-state providers. There must be systems in place to track cancellations, staff, delayed care, and patient grievances, and those stats should be made public. Wouldn't it be nice if this would have to be on their websites, where every month they would have to update their stats? Could you imagine if this was the way it was in all of healthcare in the United States? If patients could go on the website and look at these stats prior to working with a physician? It doesn't happen. It's non-existent today. I'm just throwing it out there. Maybe this is part of the solution. Second, insurance compliance must be enforced. Families shouldn't have to lose access because of administrative mistakes to their physicians, to their therapists. This is terrible. This is egregious. And this happened. Like I said, this happened to my own child right under my nose. I received an email telling me that he had been kicked out of the practice because he didn't have insurance. And here were my options to work with other providers that take kids that don't have insurance. When I had insurance, when I called well in advance to advise them of the insurance change so that we were covered, so that we were safe. Third, mental health parity laws, which requires equal treatment of mental health and physical health, need to be upheld. As you know, out there in healthcare, and even in the court systems, depending upon the state that you reside in, the parents are responsible for paying for physical health in some states, but they are not required to pay for mental health services in some cases, in some instances. This is crazy to me because these are all one and the same. You are a human, I almost said human, a human, and you mean to tell me we're separating mental health from physical health when it's health in general? It's one person, one body. Parents need to speak out. Every complaint, every letter, every record of mistreatment adds to the proof that it isn't an isolated incident. It's a humanitarian issue, civil rights issue for our children. To every parent listening who has fought to get your child seen, heard, cared for, I see you because I am you. I am. We cannot let corporate healthcare systems dictate when our children are worthy of help. We must demand compassion, empathy, structure, and above all else, accountability. Because when our children are failed, it's not just bad practice, it's a failure of humanity. I'll keep advocating. I have a whole company that does that. We've been around for 10 years. 10 years. We turned 10 this year. We have helped countless patients free of charge. We have tried to provide voices to patients when they needed it most. But for all of you out there that are going through this, you need to continue to fight. Together, we can push for a world where there's no child's mental health that is treated as an afterthought. Thank you for joining me on Humanitarian Horizons. I am Christina DiArcangelo, and this fight is for the mental health of our children, and it's for all of you out there who are struggling with this. This is a fight we cannot afford to lose. Thank you.